Most men over 50 don't lose their sexual health suddenly. They lose it slowly and only realize it when it's already affecting their confidence. What you're noticing now didn't start recently. It's been building quietly for years, long before you felt anything was wrong. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll explain what truly determines whether men can maintain a healthy intimate life after 60. Not opinions, not assumptions, but what actually happens inside the body and why most men don't realize these changes are already underway. Let me explain how this system works. When you're younger, 3 things happen efficiently. Blood flows freely to the right areas, hormones signal the body clearly, and nerve responses are quick and reliable. This entire process works quietly in the background. You don't think about it. But after 40, something begins to shift. Blood vessels become slightly less flexible. Testosterone levels start dropping, not dramatically, but consistently, about 1 to 2% every year. Nerve signals slow down just enough that the body's response takes a bit longer. The important part is this: your body doesn't announce these changes. There's no warning, no sudden symptom. The system simply becomes less efficient, month by month, year by year. By the time you notice something, the process has already been happening for years. And because it's gradual, most men assume it's normal aging. But what's actually occurring is very specific and often manageable if understood correctly. The first factor is blood circulation, and this is critical. An intimate response requires strong, consistent blood flow. But over time, especially after 45, the inner walls of blood vessels can develop small deposits of cholesterol, calcium, other substances. This is more common in men who have diabetes, high blood pressure, or years of high stress and irregular meals. In India, many men in this age group have worked long hours for decades, with late dinners, fried foods, and sweets after meals. These habits slowly affect blood vessels everywhere in the body, including the ones involved in intimate function. What most men don't realize is that difficulty here is often the first visible sign of a broader circulation issue. The same changes may also be happening near the heart. That's why doctors take this seriously. It's not just about intimacy. It's a window into overall vascular health. The second factor is testosterone. Testosterone doesn't only affect desire. It affects energy, mood, muscle tone, and the body's ability to respond during intimate moments. After 40, testosterone naturally declines. By 60, many men have significantly lower levels than they did at 30, but not every man experiences this the same way. Some maintain reasonable levels into their 60s and 70s. Others drop much earlier, often due to stress, poor sleep, lack of physical activity, or obesity. Low testosterone doesn't always feel dramatic. You may just feel more tired, less motivated, or less interested. Many men accept this as getting older and never check their levels. But if testosterone is unusually low, it can often be addressed. The problem is silence. Men don't talk about feeling less interested. They assume it's permanent, and they never ask. The third factor is nerve sensitivity and response time. Over time, nerve endings become less sensitive. This is a normal part of aging, but it's accelerated by conditions like diabetes. High blood sugar damages small nerves throughout the body, including those involved in sensation and response. Even if blood flow and hormones are adequate, signals between the brain and body may be slower or weaker. The result is delayed response, reduced sensation, or inconsistency. Many men don't connect this to their overall health. They don't realize that uncontrolled sugar levels for years can quietly damage the system they're now worried about. What happens in your 50s and 60s is often the result of what happened in your 40s. The body doesn't forget. The fourth factor is psychological and emotional state. This is often overlooked, but it's just as important as the physical factors. Stress, anxiety, depression, and relationship tension directly affect intimate function. The brain plays a central role. If the mind is distracted or worried, the body doesn't respond well, no matter how healthy circulation or hormones are. Many men in this age group carry work pressure, financial responsibility, aging parents, and health concerns silently. This isn't weakness, it's biology. The nervous system cannot perform well under chronic stress. And yet, most men would never mention this to a doctor. The fifth factor is cumulative lifestyle over decades. What you've done for 20 or 30 years matters now. Smoking affects blood vessels permanently to some degree. Excess alcohol affects liver function, hormone production, and nerve health. Lack of exercise leads to weight gain, poor circulation, and metabolic issues. Many men say, "But I feel fine otherwise," and maybe they do, but the body prioritizes essential functions first: heart, brain, lungs. Intimate function is not essential for survival, so it's often one of the first systems to show strain. This doesn't mean it's too late. Small, consistent changes now can still make a measurable difference, even after 60. If any of this sounds familiar, understand this clearly. These changes are common, very common. You are not alone, and you are not unusual. Aging is natural. What matters is awareness. Understanding what's happening removes fear and opens the possibility of managing these changes wisely. Many men improve their sexual health after 60, not because they reverse aging, but because they finally understand what their body needs. Every body is different. The patterns described here may not apply to everyone. Medical conditions, medications, and personal history all matter. This content is educational. It is not a diagnosis. If you're experiencing persistent changes in sexual function, mood, or energy, speaking with a qualified healthcare provider is essential. So let me ask you this. When you think about your health over the last 10 or 15 years, is there one habit you wish you'd paid more attention to earlier? If you feel comfortable, share your thoughts in the comments. In the next video, I'll explain the specific medical tests that help identify exactly which factor is affecting you most. Not guessing, not assuming, but measurable indicators that give real clarity. Because once you know what's happening inside your body, the path forward becomes much clearer.